Hello,
Hiya,
my name is Jade.
and I'm Qubekani, and welcome back to our channel, Asclepium.
So today we're going to be talking about stethoscopes and kind of everything from what to pick and which brand, where to get it. Obviously this time of year a lot of people will be starting to think about buying a stethoscope for their course, and yeah, we just want to kind of fill in the gap of knowledge and you know, give some information. I remember not really knowing anything about stethoscopes when I had to buy one last year, and yeah, but quick disclaimer, we don't claim to be experts in stethoscopes at all. All we can do is talk from experience, obviously. Our stethoscopes we bought, how we found it, and what we recommend from what we heard from our friends. Really. So, yeah.
But the important thing to say before we start is that whatever stethoscope you end up buying, it's gonna work, it's gonna be fine. I mean, they wouldn't be selling stethoscopes that are not up to standard. Yeah. So whichever stethoscope you end up with is gonna be fine. We're just going to talk about our experiences, why we bought the stethoscopes we have.
Yep. So first of all, what we talk about is like brand of stethoscope. So from our experience, I feel like this is like fairly important. I think a lot of people that we've like met, like everyone in our year that I know of, bought a Littmann stethoscope. And I think a lot of like almost every doctor or nurse I've come into contact with has a Littmann stethoscope, which you only really notice once you know about the different brands, if that makes sense. So I would recommend a Littmann stethoscope. I feel like that's a pretty safe choice to go with.
Yeah, it's the only brand we've ever used of stethoscope.
Yeah, so obviously we can't comment on any others, but yeah, I think
Littmann
given experience,
seems to be a safe choice. Yeah,
Littmann stethoscope. And in terms of where to buy it in the UK, I'm not sure of too many portals of where to get this. I think a lot of people I know of and like ourselves bought it from, I think, MediSave. And they were really good. The delivery was like really quick, efficient. It was like relatively cheap, and they do different deals and sometimes you can get a discount code for them. So I would definitely recommend MediSave. Obviously this video isn't a link with them. we had a positive experience with them really, and they seem to have a lot of basically the widest choice available in the UK, because when you look at the US market, they have so many more like different like colours and combinations and things that like ours is like fairly limited in comparison. But yeah, so I would recommend getting it via MediSave if you can't find anywhere else. Or I know some bookshops sometimes sell them. So maybe look into that if you want to actually see it in person beforehand. But yeah.
Plus it will also just to help like compare prices, because there might be slight differences in prices. But also in just the selection of colours, because some people will have a colour you might want and it might not be available somewhere else. But MediSave seems to be really good. And also they give you a free ECG ruler, so which you will never use. But,
I don't know how to use it.
I don't think anyone uses an ECG ruler. But anyway, some medical schools will organise like a sale day thing where you can go there and buy your stethoscope. I know Cambridge does. Our clinical school had a day where there are different stethoscopes and you could go and buy there. I think you can also get a discount, I think.
A lot of the time, because there'll be people buying like with the cohort all going. So I think definitely listen to the advice you're given in terms of only going to give you that opportunity, because you could spend more going beforehand. But obviously just play it by ear. I mean, we waited for this sale, and unfortunately there wasn't that much variety. We'd already looked online, so we kind of then waited and got it from MediSave anyway. But yeah, definitely listen to what they're telling you. So next we'll talk a bit about models of stethoscope. So I know there are classic and classic SE, cardiology. Those are the main ones that students tend to go for, like fall into that remit, if that makes sense. So in
the cardiology range, the cardiology master ones tend to have one listening side. And I mean, if you're starting out, you're probably better off going with one with a diaphragm and a bell. Because then, I mean, when you practice examinations, you're taught to use a diaphragm or a bell for different ones. So it just becomes easier. But I mean, you can do that with one, with like a cardiology master. But I think when you're starting out, that's a bit tricky.
I feel like it's probably better starting with like a classic or a cardiology, and not a master one. So I think that's definitely a good place to start. So those are the different models really, and like I say, the price is possibly the big difference between it. And obviously I think it's with the cardiology, you do kind of like, it's meant to be the tubing that's like higher quality and like the sound is transmitted better, or basically it's meant to give you better hearing experience, basically is how they advertise it. And from experience, it is really good, and I did get a cardiology stethoscope, but I think at the end of the day, it's not the end of the world if you get a classic or a classic SE.
Mm.
Obviously the sound quality's there, and the main thing you're really listening for as a medical student, having done 1 year, the main thing you're listening for is heart sounds, which you will hear with a stethoscope. Then you're listening for added sounds, which are obvious with any stethoscope, you know what I mean? And also I think the main other things is like breath sounds, listening to the lungs, and bowel sounds basically. Like I feel like that basically covers what you're listening for.
And breweries, but I don't think
I feel like you're just listening for added sounds really. So I think with that in mind, it like you will hear that with a classic or a classic SE. So if your budget is more favoured towards that, like mine definitely would have been, but I was gifted as a birthday present for getting cardiology. So I think obviously I was lucky in that position, but it really wouldn't have mattered.
I mean, that's another thing. If you can get people to sponsor your stethoscope, then...
Now we're just going to talk a bit about the stethoscopes we bought and our experiences with them. So I bought a Cardiology 4 model, and I bought it, I think the colour is plum. So I've loved my stethoscope, like I really like it. I'm really pleased with it. I feel like it's lasted really well. The model, obviously, it was gifted as a birthday present, so I was lucky in that position. And also another point I'll raise is that you can get them engraved, which I think is definitely really good, because I feel like obviously a lot of people have very similar stethoscopes, and it was very easy for one person to put it down, another person pick it up, you know, like even unintentionally, like it does happen. So I think getting it engraved, which you can get via Medisave, like definitely recommend. I feel like it definitely worth it just in case. But yeah, so this is the Cardiology 4. The main difference you'll notice between like a classic and a classic SE is that with the triangular bit here, it will just go straight into the single tubing from this point. And other than that, I think colour, I went for plum. I wanted kind of like a classic colour that hopefully I'll have this stethoscope for quite a few years to come. So I wanted a colour that would kind of like, it was something that I liked, but something that would go with like most of what I wear type of thing. And also I really liked the tubing, the kind of plastic rims on mine are kind of like a grey, light grey, which is different to other ones, and like I really liked the combination really. So I found it quite aesthetically pleasing really.
So I got a Cardiology 3. I mean the difference between the 3 and the 4 in price was like a tenner.
Yeah, I think it depends on the colour as well. Yeah. The colour changes, so I think all black is more popular, so it's a bit more expensive.
I mean, the colour really swayed my decision for this one. Yeah. The all black, like stealth look, I just loved. I had to get it. And the design, I really like this triangular design here. Like, I know design is probably not high on a lot of people's list, but I really like the design of it. It just looked steady before we got it. When I got it, it looks steady, it feels steady. The tubing feels really thick and durable. Yeah, that's the other thing. Yeah. So I just really love that. And I think it looks good. Yeah. In terms of sound quality, I have used a classic SE, and I mean you will hear everything you need to hear, but the sound does sound a bit like lower volume compared to this one. Okay. We're just like one day, one of my friends, we were just comparing the two because he was thinking of upgrading his SE to cardiology, which he did in the end. Did he? Yeah. But yeah, it's a very slight difference, but I think the design, the color, and just the fact that it looks more durable, because I'm planning to have this for as long as possible. Yeah, as long as it will last. It's an investment essentially. Yeah. I mean, they are quite expensive, like stethoscopes. So if you get one, and then you know it's gonna last you for a while, then get the one you really want. Yeah. I'd say. Yeah. Look around. Look online, just look for like a reliable source to get it from basically. Yeah. And yeah, just look at the prices as they are now. Obviously we can't really comment because I don't know if they've changed all that much in the past year. But I think the other thing to kind of talk about is how to store your stethoscope. Yeah. So and looking after them. Yeah. So I think obviously when you're on the wards, as Qubekani had it on there, you have it like most people have it around like their neck. Yeah. There is. At the start of the year, they did mention something about length differences, and I don't remember having to choose in terms of like the length of the this bit. Yeah. And I have noticed some people's are longer, but I don't remember having an opportunity to kind of pick a longer or a shorter length tube. But that is something else to look at. I don't think Medisave had that option, or we skipped it. We just so excited. Yeah, I feel like we possibly skipped that. Yeah. That. And we got like this is probably the standard length. Yeah, this is 27 inch. Yeah.
This one. But yeah, no, sorry. So when you're on the wards, you yeah.
And that's the box it comes in.
Yeah.
27 inches.
So when you're on the wards, you kind of tend to wear it around your neck. One of my friends wears it in his pocket.
Yeah.
Don't know if that still counts as wearing it, but yeah. So you kind of just wherever you feel comfortable having it. And then obviously when you don't have it on you, I bought a case as well to go with it. Obviously because like you want to look after it as best you can, because as the tubing damages, obviously that's what deteriorates the sound quality. So I did originally have it in a case, but carrying it back and forwards was just a bit of a problem. Like it took up so much room.
I didn't buy a case.
So much room. Some people at the start of the year did like transport it in the boxes that it comes in, but obviously that takes up a lot of room as well. So I think it's basically, as long as you're careful and you don't have it like rammed, and you don't want to like damage this bit either, because obviously these, you need the tension there for when you've got it in. So I think obviously just be careful with how you store it. Really, you don't have to buy a case, you don't have to store it in any particular way, just be careful basically.
No, in terms of storing it, I probably have been a bit more careless with mine. I just chuck it in my bag and I didn't have a case for it, but it seems to be holding up very well. The thing I was worried about was the black plating here, the anodized metal, because I thought it was going to start to chip. Yeah. But it looks as good as it did when I took it out of the box. So they're really like good quality things, and I think they've got a warranty for
you get like a
2 years or something.
Yeah, I think it varies depending on the model as to like how long your warranty is. But obviously
5.
Yeah, I think that's 5. I think mine was 7. I think some of them were like 3. So something else to take into consideration. But yeah.
So just another thing to add is that when these stethoscopes come, they will have a diaphragm on this end,
which is essentially just this bit but smaller, if that makes sense.
Yeah, I think it's what you can see on the box there. So that's a pediatric diaphragm. So when you get it, you can easily convert it to a bell, which is what we have done. Yeah. And I think especially for year 4 in Cambridge, or if you're starting out, you need a bell.
I think the preference is that you have a bell and a diaphragm. Yeah. Which is another reason potentially not to go for the cardiology master. Yeah. So yeah, there is that. And
in terms of cleaning them, I generally just tend to use Clenel wipes to wipe the ear tips, the bell and the diaphragm, which is very important, especially if you're going between patients.
Yeah, obviously clean it regularly.
Yeah, clean it regularly. And I don't think it damages it in any way.
No, mine hasn't changed at all. Yeah. So I think that's pretty much all we have to say on stethoscopes at the moment. Comment or send us any questions if you have any. Obviously, we can only talk from experience. Yeah. But this, like I say, it isn't a plug for Medisave or cardiology stethoscopes. Like far from it. But it's just kind of the choice has been made, and we are still happy with it. Yeah. And likewise, I have friends who got other models, and they're still really happy with them as well. Exactly. So basically, make your own decision based on like budget, the model, the reviews, and also we hope you enjoy whatever stethoscope you choose. Yeah. Thank you very much for watching. Yeah. And if you have further questions, as you said, send them on social media or just in the comments below. Yep. And we'll get back to you as soon as we can. Yep. And send us suggestions for videos you want to watch. If you enjoyed this video or you want to see more content about like medicine, application, Cambridge, the whole process, subscribe to our channel, and hopefully we'll see you again soon. Yeah. Thanks very much for watching.